If you are over 65 and at higher risk of failing, the strongest US recommendation is not a vitamin or a gadget, it is the right kind of exercise, matched to your own risk. I'm Mitsu, a registered nurse licensed in Japan. Today I will explain what current US guidance actually recommend.
More than 1 in 4 Americans aged 65 and older reports a fall each year. Fewer than half tell their doctor. And after one fall, the chance of falling again roughly doubles. But a fall is not a normal or unavoidable part of aging. The CDC says falls can be prevented. The confusing part is that fall prevention advice often arrives as a long shopping list. Remove rugs, buy new shoes, check your eyes, change your medicine, take a vitamin, do balance exercises. Which step matters most, and which steps should never be done on your own? The newest U.S. recommendation gives us a clear starting point. Then the CDC shows us how to build around it. On this channel, we start with current U.S. guidelines and official public health guidance. Then we check newer research to see whether the evidence has changed. When a new study disagrees with an official U.S. recommendation, the official recommendation comes first. This is education, not medical advice. Do not start an exercise program, stop a medicine, or change a treatment because of a video. If you have already fallen, feel unsteady, or have a medical condition that affects walking or balance, ask your own healthcare professional what is safe for you. The CDC's STEADY program begins with 3 simple questions. Have you fallen in the past year? Do you feel unsteady when standing or walking? Are you worried about falling? If the answer to anyone is yes, that does not diagnose a disease. It means your fall risk deserves a proper conversation and assessment. Tell your doctor how many times you fell, whether you were injured, what you were doing, and whether you felt dizzy, faint, weak, or rushed to the bathroom. A fall can be the first visible sign of a medication side effect, a blood pressure drop, a vision problem, weakness, numb feet, or another treatable issue. Do not hide a fall because you are embarrassed or afraid someone will take away your independence. Reporting it is one way to protect that independence. Title slide: The strongest U.S. recommendation. In 2024, the U.S. Preventive Services Task Force gave a Grade B recommendation to exercise interventions for people 65 and older who live at home and have an increased risk of falling. Grade B means the task force recommends the service because there is moderate certainty of a moderate net benefit. This is not simply walk more. In the trials reviewed by the task force, nearly all programs included gait, balance, and functional training. About 2/3 also included strength or resistance training. Across 29 trials with more than 14,000 participants, exercise programs reduced the rate of falls over follow-up periods ranging from 6 months to 2 years. Newer research published after that review points in the same general direction. Programs combining balance and strength work continue to show benefit, but the programs and participants vary too much to promise one dramatic percentage to everyone. R1. So what should you do tomorrow? If you have fallen, feel unsteady, use furniture for support, or struggle to stand from a chair, ask for a safe exercise plan. A physical therapist or an evidence-based community program can match the difficulty to you. Tai Chi may be one option. Strength and balance training may be another. Do not copy a difficult balance test from a video while standing alone. The goal is to prevent the next fall, not create one during practice. The CDC tells older adults to ask a doctor or pharmacist to review their medicines. Some medicines can make you sleepy, dizzy, confused, or lightheaded when you stand. The risk may also rise when several medicines have similar effects. Bring every prescription, over-the-counter medicine, and supplement to the review. Ask 3 questions. Could any of these make me dizzy or sleepy? Could any lower my blood pressure when I stand? Do any combinations increase my fall risk? The important safety rule is this: do not stop, skip, or reduce a medicine on your own. Even when a medicine may contribute to falls, changing it requires the prescriber to weigh why you take it, possible withdrawal effects, and safer alternatives. Medication review is one part of a plan. not a replacement for exercise, vision care, or checking other risks. The CDC and USPSTF list several changeable risks that are easy to miss. First, vision. The CDC's patient guidance recommends an eye exam every year and updating glasses when needed. Give yourself time to adjust to new lenses. Second, blood pressure when you stand. If you become dizzy or wobbly after getting up, tell your clinician. They may compare your blood pressure lying down and standing. Stand up slowly and do not use furniture walking as your long-term solution. Third, feet and footwear. Numbness, foot pain, loose slippers, smooth soles, or badly fitted shoes can change the way you walk. Choose low-heeled shoes with good traction and support. If you need a cane or walker, have it sized and taught by a professional rather than borrowing one and guessing. These checks are not equally necessary for every person. That is why the USPSTF says broader, multifactorial interventions should be individualized instead of automatically given to everyone. The CDC's 4 patient steps include making the home safer, remove clutter and tripping hazards, improve lighting, and use secure supports. Start where falls would be most dangerous: stairs, the bathroom, the route from bed to toilet, and places where you turn or carry things. Secure handrails on stairs. Use a properly installed grab bar near the tub or shower, not a towel rack. Keep a light within reach of the bed. Remove loose cords and clutter from walking paths. Wear shoes with traction instead of walking in socks on a smooth floor. The evidence for home modifications is less uniform than the evidence for exercise. So focus on changes tied to your actual risks instead of buying every fall prevention gadget. The CDC's priorities are secure supports, clearer walking paths, and safer high-risk areas. If you have fallen repeatedly or have significant mobility problems, an occupational therapist can examine how you actually move through your home and recommend changes for your specific risks. You may have heard that everyone over 65 should take vitamin D to prevent falls. This is a good example of why dates matter. The CDC website still distributes a steady algorithm whose PDF text dates from 2019 and includes checking vitamin D intake. The newer 2024 USPSTF fall prevention recommendation does not include vitamin D. It moved that question into a separate evidence review. So this video does not recommend starting vitamin D just to prevent falls. Vitamin D deficiency, osteoporosis, kidney disease, and fracture treatment are separate medical questions. If your clinician prescribed vitamin D for a specific reason, do not stop it because of this video. Ask what it is treating. Red flag slide. If you fall and hit your head, the CDC says an older adult should see a healthcare professional right away to check for a brain injury. This is especially important if you take a blood thinner or an antiplatelet medicine, because bleeding inside the skull can be more dangerous. Call 911 or go to an emergency department immediately after a head injury if you have a worsening headache, repeated vomiting, new weakness or numbness, a seizure, slurred speech, unusual behavior, increasing confusion, one pupil larger than the other, loss of consciousness or extreme drowsiness, and difficulty waking. Emergency help is also needed if you may have injured your neck, back, hip, or pelvis, if there is severe bleeding, or if you cannot safely get up or bear weight. Do not force someone up after a serious fall. Even when you feel okay, tell your regular clinician about the fall. The cause may still be treatable. Here is the U.S. guideline order. First, speak up if you have fallen, feel unsteady, or worry about falling. Second, start with the strongest recommendation, a safe program that trains balance, walking, daily function, and strength. Third, review medicines with a doctor or pharmacist, never by yourself. Fourth, check vision, standing blood pressure, feet, shoes, and walking aids based on your risks. Fifth, make the dangerous parts of your home safer.
Answer the CDC 3 questions and share them with a healthcare professional. Subscribe for clear, evidence-based health guidance. Take care and stay steady.